do want to present what the ADLIFE patient empowerment and shared decision-making platforms are and look like, and they're going to look very familiar to you because you already heard Klaus speak about Denmark, and you just now heard Catalonia, and it's going to look very familiar. So basically, what is ADLIFE? ADLIFE is a Horizon 2020 project, which is basically under the call for large-scale pilots of personalized and outcome-based integrated care. There are 10 partners in 8 different countries. And basically, the objective of ADLIFE is to provide a digitally supported integrated solution for patients with advanced chronic diseases, namely congestive heart failure and COPD, but advanced congestive heart failure and COPD. And essentially, with these patients, we're talking about patients with advanced chronic disease. You're not trying to cure them. You're trying to prevent them from getting worse. You're trying to improve their quality of life and the quality of care, and empower them and their caremakers and give them. Now, I think one of the important things to say, as opposed to what has been said so far in presenting the systems, is that what ADLIFE wants to do is provide personalized integrated care. So deploying the ADLIFE toolbox to improve patients' health condition and to change the traditional care models for advanced chronic patients by integrating unconnected care tasks at different events in different settings and integrating among the various stakeholders that are involved in the care of the patient. So we want to facilitate a more active role of patients and caregivers, deploy the new tools, the digital tools that we're developing to support this, and assess their effectiveness. Now, I want to point, and here's, before I get to the digital toolbox, I want to make one very, very specific point, and it sort of relates to what our Canadian colleague said earlier for those of you who heard him. And he talked about interoperability as a means to an end, and he also talked about the importance of the behavioral side of it as opposed to the technical side of it. And we're talking here not about data sharing. We're talking about integration among people who don't, normally speaking, really know how to work together in an integrated way. So you can give them all the tools you want, but if you don't have people who are willing to work together as a team, the tools never achieve their actual aim. So the ADLIFE Digital Toolbox is comprised of basically 3 components. One is a digital patient care planning management platform. And that's meant to basically create or support the creation of a joint patient care plan, joint between primary care and hospitals. How many of you know hospitals that talk to primary care physicians to create a joint patient care plan? You know, we have the data, we have the tools, we have in many places, and it still doesn't happen. So the first thing we're talking about is a platform where you can invite all of the stakeholders to be team members and to work together to create a joint plan. Then the other point, or the other really important part of this, is that there's a clinical decision support system, which then works on, is a part of this platform to raise questions and recommendations and guidance mainly to the healthcare professional. And then you have the digital patient empowerment platform, which is integrated with, all of these systems are integrated together. So this is what it looks like. You basically have the personalized care plan management platform, you have the clinical decision support system, and you have the patient empowerment platform, and essentially you have the local EHR in each of the countries that goes into a FHIR depository. Likewise, the information from the PCPMP and the patient empowerment platform go into the same repository. But from the local EHR to the depository, there is basically a technical interoperability suite and a semantic interoperability suite. And I'm emphasizing this because it's really important to the points I want to discuss at the end. So patient empowerment, and I'm skipping over this. You know what patient empowerment is. It basically, it supports patients in terms of having access to their own information, managing their care, and participating with their healthcare provider and making the decisions about their care. And in ADLIFE, basically, there were two basic tools that we used, and one of them my colleague just talked about at great length. One is PROMs, and the other one is shared decision-making. And those were the two main activities that we're digitally trying to support in ADLIFE. So the PROMs that we're using are the usual culprits, right, that everybody knows about, and they're used in every umpteen project, like EQ5DL and CAT and PQC. All of these are things that we've used before, but we use them, and we use them for research, and we never use them for the care of the patient. And so what we're trying to do in ADLIFE is actually use these PROMs so that it can guide the care decisions that the professionals make together with the patients. And the shared decision-making that we built into ADLIFE is basically based on the share concept, where you're talking about, you're telling the healthcare professional to seek your patient's participation, help your patient explore and compare treatment options, assess the patient's values and preferences, and reach a decision together. The thing on the side, I don't know if I have but this basically is the way it looks in the ADLIFE platform. So the major functionalities of the ADLIFE patient empowerment platform are really the care plan, which enables the patient to see it and to provide feedback and to contribute to it, as well as his caregiver, by the way, because many of these patients are elderly, and they have a very active involvement of a family member or their caregiver. To record the patient observations, patient-reported outcome measures, the PROMs we talked about, symptom reporting, and safe messaging with healthcare professionals. And some of the other functions are that enables the patients to communicate with other patients through a patient forum, access to educational materials, shared decision-making via decision aids, delivering just-in-time adaptive interventions to patients, which is really a kind of reminder. And this is what it looks like. This is the patient dashboard. By the way, this is the patient dashboard on his desktop. That's what it looks like. And here's what the patient care plan screen looks like on the desktop, but the majority of patients are using mobiles. So here's the same thing, but now the way it appears in the mobile app, which the majority of patients are using. And so you can see all of the same functions that you saw on the previous screen are here in terms of the patient dashboard, the care plan on the mobile app, which includes basically, like in this particular decision, they're talking about, what is it, diet? And whatever it is, the goal, and then the activities that the patient is basically assigned to do, and how he does it. Also enables the patient to view his previous measurements when he's submitting new measurements. So if you're asking him to measure his blood pressure, you show him what his blood pressure was like before. If you're asking him to measure his weight, to weigh himself, then he sees what his previous weight was so that he can see where he's at. And another function that's really important is messaging. So basically, that's what the platform looks like, okay? And it's not so different. It's not so different from what the patient portal of the Catalan system. It's not so different from what the Danish patient is able to see. And certainly, for example, from my country, it's not so different from what the Israeli patient sees when he goes into the patient portal. I think the thing that's important, and that's what I really want to talk about, is that we have a number of partners in this project who are really very sophisticated. For example, I would say that the Basque country, which is the coordinator, has probably a system that's not so different in terms of level from the Catalonian system. It's also very advanced and very sophisticated and very integrated. And in fact, it's more integrated because they have one system that both the hospital and primary care uses, so they don't have to mediate between two systems. So it's already really integrated. And the Israeli system is also really integrated. And some of the German system, with all due respect to our previous speaker, is not integrated at all, and is missing basic. But nonetheless, what we found was the platform is beautiful. The platform was created by SRDC, which is a Turkish company, together with the other partners and with a lot of clinician input, and it's beautiful. It's got phenomenal functionality. It's beautiful. And where are our challenges? Our main obstacle is this word that we've heard 100,000 times today, and that's interoperability. And you know, I remember back when I was listening to everybody talk about interoperability and the different, I remembered my first World of Health IT conference. How many of you remember the World of Health IT, which was like, what, 15 years ago? And that was the first time I ever heard the word interoperability. I couldn't figure out what it meant. And you know something? I still can't figure out what it means. But when the ADLIFE solution wanted to achieve interoperability, which meant that it could integrate with the existing systems in the partner countries. So they used HL7 FHI so that they could, that as one mechanism. And they also limited their ambition. They said, okay, we're not going to do a two-way integration. We're going to do a one-way integration from the EHR to the platform. And then basically the healthcare professionals and the patients will all work together on the platform, basically in the interaction between them and creating the patient care plan, in getting the patient's PROMs in, and getting the patient's measurements in, and being able to message the patient. Basically, that's the purpose of the platform. So they only did a one-way integration. They said they're not going to send the data back from the platform into the EMR. And the professionals continue to work on their EMR, and this is sort of like an added benefit for them to enable that patient, each healthcare professional relationship, and the teamwork of a multidisciplinary team together with the patient and his caregiver. And you know what? That was probably the biggest stumbling block in the project, because everybody was using a different legacy system. There were different codes. Even if they used ICD-10, so they pretty much got that under wraps, but different codes for medication, different codes for laboratory tests and other diagnostic tests. The systems were all uniquely different, and that reminded me when I was listening to Klaus this morning, and he said, you know, we've got a system. We were like an early starter, an early implementer, and we spent billions building our system, and it works great. And if we start doing interoperability and developing new regulations and new requirements at the European level, for us to start changing our system, it'll cost us millions of euros. And our system works great. And I would say, I guess the Catalonians would say the same thing. So that was a real challenge, and I think that challenge reflects the reality of today. And of course, all of the things that you need to do in order to create interoperability, it's not only semantic interoperability, you have to map the way the system works and then adapt all of the APIs. Okay, so I'm almost at the end. But I think coming back to, again, our Canadian colleague, I think the major challenges are not technical. The major challenges are people and organizational challenges. So you need to have, in any organization or in any region, upper management support for changes in care processes and digital tools. And it's not just digital tools, it's care processes. And they have to be able to enforce the use of, or the changes in the processes and the use of new tools. Healthcare professionals are resistant to change. They have time pressures, and so there's the whole issue of training and learning to use new tools, and insufficient benefit and incentives. They don't see what it adds for them. And that's a really big area that has to be discussed and has to be addressed, and that is the incentives, and the benefits. And ultimately, we still have an issue among healthcare professionals of digital literacy. And as far as patients are concerned, especially when we're talking about elderly patients, not all patients want to be empowered. Empowerment is more dependent, by the way, we found, on the doctor-patient relationship than, for example, the nurse-patient relationship. Patients, our systems are still very, very physician-oriented. There are specific areas where patient empowerment is more successful, such as, for example, medication adherence. I think there, the digital tools and the reminders really help. Biometric reporting, in order to get patients to continuously report, you need to be able to provide motivational responses in order to sustain that, because patients get really tired of doing this after a while. And questionnaires need to be short and infrequent. There's obviously an issue of digital literacy. And what's really important, and Oscar mentioned this too, is the fact that the patients have prior experience using a patient portal. It makes a big difference in terms of empowering patients. So some conclusions are that the transition to value-based healthcare, as Deepak defined it, is more dependent on organizational and people factors than on digital tools. And here's some suggestions for how doctors can strive to facilitate patient empowerment, but that means the doctor has to want to facilitate patient empowerment. And digital tools can enable value-based healthcare, but they're unlikely to drive it. The drivers are not the digital tools. And so I would like to sort of raise a question, and that is that we may need to change the way we talk about interoperability, particularly when we talk about it at the European level. And I wonder if we wouldn't be better off, rather than trying to build the vision that our initial speaker spoke about this morning in terms of his vision of the European integrated system. I wonder if we wouldn't be better off if we wouldn't take countries like Denmark and Catalonia and partner them with other countries and help them, based upon their experience in building their systems, to adapt and help them build it. If we want 99% of our patients to be empowered and have access to their own information, we first have to do it at the national level. I don't think it can be done top-down.